An old medical theory renews itself as a cancer-fighting treatment. Yesterday, Good for Utah's Nadia Crow introduced us to hypothermia therapy, basically heating up cancer cells and killing them.
Give me the power to create a fever and I shall cure any disease. Those famous words spoken 2,000 years ago by Hippocrates, the founder of Western medicine.
According to cancer.gov about hyperthermia, research has shown that high temperatures can damage and kill cancer cells, usually with minimal injury to normal tissues.
1982.
Senior consultant and professor Dr. Niloy Dada has been researching and administering hyperthermia therapy ever since. We met him in New Orleans for an international conference on hyperthermia. He told us about one patient over the age of 75, unable to withstand chemotherapy for his sarcoma.
Only protons on hypothermia. There's no chemotherapy and, if possible, no surgery.
Other oncologists wanted to amputate his knee. Dr. Dada said no. After hypothermia therapy,
and the patient is walking in front of you, no crutch, he is going for ski. What else do you want? You don't want anything else, I believe.
Well, we've known for a long time that heating cancer cells kills them. And there's been actually decades of research devoted to trying to understand that effect. And there are a number of clinical trials that have been undertaken to try to understand how better to use heat.
Therapy group had a complete response of 38%. With hypothermia, it increased to 60%. And that's the forest plot for the odds ratio. And what you find here is a nicely diamond here placed well in this side, which gives in fact an odd ratio of 2.6, which is highly significant, favoring radiotherapy and hypothermia. What are the results that we have got using hypothermia and radiotherapy, the published literature? Now, hypothermia is certainly a unique therapeutic modality with unique abilities. And as defined, it's something, a temperature which we play with around, say, 40 or 39 to 43 degrees centigrade. And it increases blood flow. Yes, I think we all agree to it. It improves the tissue oxygenation. It also thereby sensitizes or increases the oxygenation of the hypoxic cells, and thereby making it heat sensitive. It inhibits the DNA repair, which is, I think, one of the major factors of a loss of radiation sensitivity. It also sensitizes the S phase cells, and there are certain tumor cells like melanomas which are supposed to be intrinsically heat sensitive. So these are some of the things which actually hypothermia is doing for us. And now if you look at the heat is still on, and he goes on to say that there is sufficient underlying biology to argue for a substantial benefit, and hypothermic oncology represents the strongest mean to improve ionizing radiation which we have ever seen, and is far superior to any other type of biological modifications. Not only this, he goes on to add that the most powerful way of sensitizing ionizing radiation, in fact, is heat. And this needs to be fully explored, of combining radiotherapy and hypothermia, but must be done with an open mind and a cool head. And in fact, could even be termed very rightly as a poor man's high LAT radiation. So if we take all these together, one thing comes out, that indeed it is a potent radiosensitizer. It has also been shown to be synergistic to a number of chemotherapeutic agents, and above all, I think what we just heard from our various colleagues, that there's no significant added morbidity. So therefore, is there any treatment which is as unique as hyperthermia? I don't think so. So, I think I'm not very wrong to say that hyperthermia is indeed a unique therapeutic modality with unique abilities, and therefore we need to see it more closely.
Our immune system is designed to fight any disease, including cancer. It starts in the lymphatic system. Our lymph nodes produce tumor-infiltrating leukocytes, or T cells for short. One method T cells use to differentiate healthy cells from cancer cells is a genetically coded receptor called programmed cell death protein 1, also known as PD-1. When PD-1 sees its counterpart PD-L1 in a healthy cell, it ignores it. When it detects a missing PD-L1 in the abnormal cancer cell protein, it destroys it. So, why does our immune system allow cancer to exist? Cancer cells can hide from T cells using a false identity, causing the T cell to let the cancer pass. Applying heat to the cancer tumor can boost the immune system to recognize the invasive cancer cells. Heating a cancer tumor to 42 degrees Celsius, considered fever temperature, will stress the cellular function of an already poorly developed cell structure, causing cell death. Healthy cells recover quickly from this stress effect. During cell death, cancer cells express heat shock proteins and the release of antigens, molecules that provide specific information about the invading cancer cell. And they can be used by the immune system to unmask the hiding cancer cells. Dendritic cells scoop up these antigen particles and return them to the nearest healthy lymph node. Heat shock proteins chaperone the cell production of the newly evolved T cells that can now detect the once hidden cancer cell. Not only will the T cell go to work killing the cancer tumor, but move throughout the body identifying stray cancer cells that lead to metastases, stopping the spread of that specific cancer. Heating aids the process by increasing blood flow to the tumor, allowing more T cells to join the fight. Hyperthermia has long been an adjunct to surgery by shrinking the tumor, and chemotherapy and/or radiotherapy by sensitizing the tumor and boosting the effective dose. With the discovery of immune modulation, we see a bright future for hyperthermia as an adjunct to immunotherapy.